Good morning everybody, Namaskar. So today I will discuss about the introduction of pathology and introduction of hematology. So before starting the new topic, we have to discuss about the introduction. So first I will tell you about the introduction of pathology. So you have to read the two type of pathology in your course, like general pathology and clinical pathology. But most of the time you have to deal with the clinical pathology only. And general pathology means you have to read there the causes, effects of the diseases, and you have to diagnose them on the basis of the symptoms, sign. Okay, so you have to diagnose them first. But when you have to diagnose and diagnosis where you have to do the diagnosis, so that field is comes under the clinical pathology, where do the work and where you diagnose the patient, where you collect the samples and you process the samples. So in clinical pathology there are so many branches. There are various branches in clinical pathology. You have to know them. Like hematology also under comes the clinical pathology lab, and microbiology which deals with the microorganism, immunology which deals with the antigen antibody, and histopathology which deals with the tissues, diagnosis of tissues basically. Suppose any patient is suffering from the cancer and he has the warts somewhere else, so you have to collect the sample from there in the process of FNAC, fine needle aspiration cytology, and you have to process them. Yeah, there is another process. Suppose if you have any warts inside you, in liver, in GIT, and everywhere in your body. So surgeon, what will surgeon will take it out and send it to process for the further diagnosis. So such conditions comes under the histopathology process. So you have to process the tissues basically in that condition, and you have to prepare the slides on a slide, and with the help of staining and with the help of microscope you have to see the cells, that which type of cells in that slide, and you have to identify them, and you have to decide, you have to segregate it, that which type of disease that is and which type of cell they are. So all things I have recited are come under the pathology, clinical pathology basically. If I'll talk about the hematology matlab, so hematology means study of blood. If suppose there are so many type of tests you have seen in already, like CBC, complete blood cells, and hemograms. Hemograms means you have to process the hemoglobin, total leukocytes count, differential leukocytes count, and ESR of the patient who is coming to you. And all tests who belong to the blood, and you are testing the test in the form of blood, are come under the hematology. Like there are numerous type of tests like CBC, RBC, HB, TLC, DLC, PCB, MCB, MCH, MCHC, platelets, and like. So all tests I have, as I recited, are come under the hematology. Okay, so this is another branch of clinical pathology. Then next is microbiology. So microbiology means like there are so many types of microorganisms, like viruses, bacteria, parasites, and fungus. So parasites means all of you know parasitic infection, and they are the very large in size basically as compared to the viruses and bacteria, and especially you cannot see the microorganism without the help of microscope. If you want to see the microorganism, you cannot see them by the naked eyes. You have to take the help of the microscope if you want to see them. Okay, except the parasite. This condition that does not follow for the parasite, because the parasites are very large in size. They are basically are very gigantic, so you cannot see them without use of the microscope. So there are so many types of bacteria. I'll discuss one by one. So bacteriology में you have heard so many types of bacteria, and most common in India and in all developing countries that is tuberculosis. And the causative agent of bacteria is Mycobacterium tuberculosis. So Mycobacterium tuberculosis cause the TB, tuberculosis in human. Okay, and there are so many types of bacteria like Staphylococcus, which cause the hospital-acquired infection and the pyogenic infection in men, and Streptococcus that causes the rheumatic fever, Pneumococcus that is the primary or main causative agent of the pneumonia in children. Okay, so Gonococcus, Pneumococcus, tuberculosis, Mycobacterium and E. coli, Vibrio cholera. This is the causative agent of loose motions, basically that is called cholera disease in children. So there are various types of bacteria you have to deal with it, and we will talk and we will tell you and we will teach you also. Okay, so next is virology. So in virology there are so many types of viruses like influenza virus. Now you are confident these days the coronavirus also the virus, and all of you know, and all bodies of the world have known the importance, have known the significance of the microbiology field. And this is very good news for the microbiologist, because before the coronavirus there are only some selected people who belong to the medical field who know about the microbiology, what is this. But the importance of microbiology, I can tell you, all doctors, all physicians only do prescribe the drugs on the basis of microbiology. They are handicapped without us. So there is very extensive field of microbiology, even you cannot describe. So virology, there are so many types of virus like poliovirus. This is a well-known disease, of the India. People suffer from the physical challenging. And dengue virus also very well known for India, especially in developing country. And malaria, and there are so many types of other viruses than like dengue virus and influenza virus, coronavirus, and Zika virus. Okay, so they are the viruses, and you cannot diagnose viruses in artificial medium. You have to only culture them in the living materials like cells. But in case of bacteria, you can culture the bacteria in artificial medium. We have only there is one thing we have to maintain, that we have to provide the proper nutrients for the bacteria as they get inside our bodies. Okay, so if we provide the proper nutrients for the bacteria as they want, so bacteria can grow in the artificial medium also. But this condition does not apply for the viruses. Viruses only require the living cells, living things to grow. So this is the main difference between the virus and bacteria. Then third is parasite. So parasite infection, all of you know what is. Only the well-known disease of parasite infection only happen for the farmers. Those do the works by barefoot and bare hands in the fields. So basically parasite can crack your skin and can enter the cracky side of your skin and can lodge in your organs via the blood and via the capillaries and the venules and artery system. Okay, so like Ascaris is a disease that caused by the Ascaris lumbricoides, Ankylostomia duodenale, malaria parasite, and that is there are so many types of parasites like Trichomonas vaginalis, Giardia lamblia, okay, and like Fascicular hepatica. They are the parasite. Trichnesolium, Tines aginata, they are the all are the parasites. Okay, so and next is the immunology. In immunology, you have to deal with the antigen and antibody. So I don't think so that you don't know about the antigen and antibody, because nowadays and lately you are confronting a new virus, that is coronavirus, and everybody is under the dismay of coronavirus. Okay, everybody is frightened, everybody is hiding inside because of coronavirus. Everyone is affected, everybody is affecting. Okay, so ये वायरस थे. Okay, so in coronavirus, basically doctor are saying you have to boost your immunity if you want to fight with the coronavirus. So what is the meaning of immunity? Immunity means you have your immune system is intact inside you. If your immune system is properly intact inside you, you can fight with the antigens. And virus also is called as antigen. Antigen is any foreign particles is entering inside you from the outside of your body. Okay, so are called the foreign particles. So foreign particles means foreign particles may be virus, maybe bacteria, maybe dust particle, maybe pollen, anything else which is coming from the outside inside you act as the antigen. So your immune system have to prepare the antibodies and the cells through the T cells. So T cell will convert it into the so many types of subtypes of T cells, like interleukin, tumor necrosis factor, like helper T cells. Okay, so they will fight if you are getting the intercellular infection, intercellular antigen. If you are getting the extracellular antigen, so your B cells will transfer into the plasma cells, and plasma cells further transform into the antibody, and they will fight with the antigen, and that is called the antigen antibody reactions. Okay, and there are so many types of cells also, like neutrophil, eosinophil, monocyte, basophil. They can also kill out the antigens, and that process is called phagocytosis. And mycology means you have to deal with the fungus. This is also comes under the clinical pathology. Okay, so in my opinion the topic is over. Your introduction class has been complete. So thank you so much for watching this video, and please do study hard, don't waste your time, don't lose your money also. Okay, so thank you so much. Namaskar.